Hi everyone, today we're going to talk to Dr. Victor Chan, who works for Performex Health Group in Burnaby on Kingsway. He's a naturopath and we're going to ask him how he got involved in this. Hello Dr. Chan, how are you doing today?
I'm doing fine, thank you.
Doctor, first can you introduce yourself?
Sure, my name is Dr. Victor Chan. I'm a naturopathic physician. I've been working as a naturopathic doctor for about 8 years now, and currently I'm practicing at Performex Health Group here in Burnaby on Kingsway.
How long have you been doing this?
Well, I've been a naturopathic doctor for about 8 years, but I've been here at Performex Health Group for 3 years now.
That's fantastic. Now, when you were in school, did you know that one day you're going to be a naturopath, or what you wanted to do in future?
No, actually that's a funny story. To be honest, until maybe about 10 or 11 years ago, I never even knew what a naturopathic doctor was. I had been going to school and really sort of trying to find my path and decide what I wanted to do for a living, and it just sort of fell into my lap. And I guess in the end, being in school and sort of keeping all my options open was actually what led me to become a naturopathic doctor, and I'm extremely grateful that that's what happened.
Now, when you were in school or college, who inspired you?
Well, I think, definitely, to be honest, the way I was raised by my parents, they are an immigrant family. They came to Canada with not too much, and really stressed the importance of having an education and studying hard. So my parents definitely were my main influence. But other than that, I had a lot of really helpful teachers who, were willing to push me and not just let me settle for just doing okay. Yeah.
So when you were studying, were you with the books 24/7, studying all the time, or were you also going out with your friends, having good time, and how did you balance your life?
I think, that definitely was one of the main things that I have to credit my father for. He definitely did not want me to become one of those people who was always in front of the books. And he wanted, because he came to Canada and, he wanted me to be Canadian and be involved in other activities and interests outside of just school. And he didn't want me to have too much free time to get in trouble and maybe spend time on things that weren't so productive. So when I was young, I played hockey, I was involved in piano lessons, and also another important thing that my parents encouraged was being involved in volunteer work.
That's wonderful. So, do you have other siblings?
Yeah, I have a younger sister. She also lives here in Burnaby, and she has her family not too far away from where the clinic's located.
Did your parents have any expectations of you? Did they say that, I want you to do this and not that? Or were you able to tell them what you wanted to do in life? Was that, easy transition for you, or was it difficult?
I don't think my parents had any specific expectations other than, yes, they did want me to graduate and go on to post-secondary education. But what that was, whether it was to, study philosophy or become an engineer or, design architecture, they didn't really guide me in any way. For example, none of the rest of my family is involved in healthcare at all. But I think it was mainly a philosophy in that, whatever you do, try to do it well, or at least maximize your potential.
What is your biggest strength?
I think, to be honest, I feel like one of my biggest strengths is that I have belief in myself, a confidence, and I think the reason why that's important to me is that it makes you not afraid to try. Like if you don't succeed, I'm not afraid of not succeeding, because I know that if I have enough time and spend enough effort, one day, it will be successful, and I think, a lot of times for a lot of people, they're their own worst enemy. It's not, nobody else can really tell me that I can't do anything unless I've had a chance to try it first.
Dr. Chan, can you please tell us about the treatment that you give your patients?
Sure. I'm a naturopathic physician, so I treat pretty much anything and everything that comes in through my door, and all my treatments are focused on stimulating the body's natural ability to heal. But I do have a special interest in a number of therapeutic injection therapies, including trigger point injection therapy. Now, trigger point injection therapy is used, for example, for people who've been in car accidents or falls and they've injured themselves and now experience a lot of pain and discomfort due to muscle tightness or even spasm and inflammation. And what it involves is using a really tiny needle and some vitamin B12 and a little bit of lidocaine, and we try to actually release the musculature so that the pain and inflammation decreases.
That's wonderful. So, does it have any side effects?
No, there's no side effects from the treatment. Again, because we are using vitamin B12, which is a vitamin, and lidocaine, which is something that breaks down quite quickly in the body. Really, the only side effect from the treatment is from the needle. So there might be a little bit of temporary soreness, but that's very temporary and would be the kind of soreness that would be similar to after having a very deep tissue massage.
Now, sometimes the muscle stiffness can cause headaches or cause some other problems. So, with this treatment, you are treating not only the muscles, you're also treating the other problems.
Yeah, I think it's really important to understand that, everything's connected. So that while somebody may at first come in and complain of very severe headaches, the first thing we have to understand is what's causing the headache. There are a number of different potential causes. And in this case, when we're talking about trigger point injection, quite often the cause is extreme muscle tension. And that muscle tension may not actually originate anywhere close to the head. It may be in the shoulder, it may be in the neck, it may be even further down into the upper back region, or lower for that matter. So, as we treat, it's quite often that we'll find, we treat one area and then my patient will say, "Oh, Dr. Chan, that area is better, but now it's moved." And I always tell the patient, you know what, it probably hasn't moved. It's just that now your mind, your brain is able to focus on the area that hasn't been treated, even though all along it was injured as well.
Sometimes a person has chronic pain, or they sort of start living with it. They learn to live with it, and they say, "Oh no, this is how my life's going to be," and they start taking extra strong painkillers, and slowly the dose is increasing, or they switch from one medication to other medication. And sometimes some doctors or specialists also say that it's going to get worse as you grow older. So what you are saying is there is hope.
Well, it's partly the naturopathic philosophy is that, the body has an innate natural ability to heal. But there are limitations to that. And the limitations are that, one, you have to make sure that the body's not missing anything. Two, you have to try to make sure that the body's able to get rid of things that there might be too much of in the body. And three, structurally, if something structurally is broken or not aligned properly, the structural body has to be treated. So, there is a time and a place for medication, of course. And, quite often, when we have injury or chronic pain, we're dealing with medications that are anti-inflammatory or muscle relaxants or painkillers. But, I think it's important to understand that the vast majority of the time, these are not treating the cause of the problem. So we can use medication to be more functional and live our lives a little bit more fully. But in the meantime, we should be treating the cause of the problem. And so in my practice, medication is something that patients can use in conjunction with things like trigger point injection therapy or other therapies that are working at treating the injuries themselves.
While I was sitting in the waiting area, I was talking to a couple of people who were sitting there just to get their feedback. And they have been coming here, and they were saying that yes, our bodies are getting better. Also, our frame of mind is changing, the way we think. So you are talking to them while you're treating them and changing the way they think about their problem or life. That's amazing.
Yeah. Well, again, part of naturopathic medicine is that you have to treat the individual. We're not treating a bad back, or we're not treating a broken neck, or we're not treating, a depressed person. We're treating each individual patient. And everything affects everything else. So to think that we can just diagnose somebody and whatever the diagnosis is, there's a specific recipe to treat that problem is not, I don't think that works very effectively, because there are many factors that influence somebody's health, not just the physical problem. There's the mental emotional state, maybe relationship issues, could be financial, all these things are connected. And so, of course, the majority of the issues that I see in my practice day to day, they are made 10 times worse by stress, mental emotional stress. And the most stressful thing for a patient or anybody is to feel like what they're dealing with is out of their control. And so a lot of the times what I tell patients is that don't focus on the things that are out of your control. Focus on the things that you can control, like what you put into your body. So we talk about diet and nutrition, exercise, moving your body. And then let's stimulate your body's natural ability to heal, and then we'll let the rest take care of itself.
When I was in school, I used to believe in that when money is lost, nothing is lost. When health is lost, something is lost. When character is lost, everything is lost. But now, at this time and age in life, I used to think whenever I got migraines or any pain in my neck or back, I used to say, no, if health is lost, everything is lost, because you can't even think straight. You don't want to enjoy anything. How can you work on building your character or doing something for others if you're not feeling good? So it's very important to feel good, but when we go to see a doctor or a specialist, they don't have enough time for the patients. They don't have enough time for the patients. So do you have any message for those doctors?
Well, first of all, I have to start by saying I feel very fortunate. I am in a profession where I have that luxury to spend time with patients, because when it comes down to it, another one of the naturopathic principles is doctor as teacher. So a lot of my visit is about teaching, not just teaching in a sense that, I'm teaching you something that you don't know. Quite often, the teaching that I do is just reminding people of what they forgot. They knew it, but they forgot it because the pain that they have is so intense that they only focus on the pain, or they're so fatigued or tired, they're only focusing on how tired they are, or their depression is so strong, they're only focusing on the depression. So what I'm teaching or reminding patients is don't focus on the disease. Focus on the healing that your body can actually, stimulate and it can actually achieve. And, I don't have any specific comment or information to tell other doctors because every doctor's goal is to help their patients get better. I only know what works for me, and for me, what works is to spend time with my patient and have them have a sense of, you know what, I can control and I can have a positive influence on my own health. It's not just something that I have to pray for at night or something that somebody's going to give to me. Actually, most of it is what I can do for myself.
Now, doctor, you have beautiful heart, you have beautiful soul. Do you have any message for youngsters who are going through pain due to some injuries, whether it's, they have injured themselves while playing sports or involved in an accident or any fall? Do you have any message for them?
Yeah, I think, as a doctor and just as a person, the one thing that I would say is that, when you are injured, when your health is not at its best, sometimes you cannot focus on the untapped potential that you or your body has. And sometimes it is helpful to talk to somebody else who can give you a little bit of perspective, whether it's your doctor or your parents or your peers. You're not alone, and that everybody needs a reminder once in a while. And again, as a naturopathic doctor, what I know is the body always has the ability to heal. It doesn't mean that you'll be exactly the same as you were before, but what you can do may be the same or even surpass what you were able to do before. You just need a little bit of perspective to look at what you can achieve, whether you've been in an unfortunate accident or had some negative things happen to you. It doesn't mean that you cannot achieve all the things that you wanted to or more.
Thank you so much, doctor. And your contact information, your phone number, please.
Okay. So I practice at Performax Health Group in Burnaby. We're at 6170 Kingsway. And the number here at the clinic is 604-433-0100. Or you can visit my personal website at www.drvictorchan.com.
Thank you, doctor, and all the best.